Hello all, myself I am Dr. Nagalakshmi V from the Department of Physiology. Let us discuss one more that is outcome based education, which is a part of the question bank software preparation. So at the end of the session, the participant should be able to understand the various principles and the need or requirement of outcome based education, define program, course as well as program and course outcomes, how to map the course outcomes with the program and program specific outcomes, and how to derive CAM, that is course articulation matrix, and finally how to achieve PO attainment, which includes both direct and indirect attainments. So outcome based education is a kind of educational strategy which is targeted at achieving the desirable outcome. For example, if MBBS is a program, so the outcome is an Indian medical graduate, and what we expect from our Indian medical graduate, that is the outcome. So which includes what knowledge and what skills, what attitude and behavior they should achieve at the end of that specific program. So when we design and we talk about outcome based education, the framework go hand in hand with the Bloom's taxonomy framework, which is already being discussed. So we already know that Bloom's taxonomy is a hierarchical framework towards achieving the educational objectives. So why do we need to know about this outcome based education? See, as a university, we have to undergo something called accreditation. So, and this usually the university will be accredited by the National Assessment and Accreditation Council, that is NAC. So to achieve this NAC, in order to give any recognition to the university, so they have to adapt outcome based education. So for that, not only for that, in order also to make our students to meet the global standards, we have to, each university should have certain accreditation. So as a part of NAC, outcome based education should be now implemented by the university. So as we know that our university, because we have now a private university, we have to start implementing outcome based education. So how to design the outcome based education? What are the principles of it? So the first principle is designment of curriculum. So for example, once we know that what we are expecting from the student once they complete a program, so we can design our curriculum based on that. So for example, Indian medical graduate, so once we know that what and all they should be learnt at the end of MBBS program, our curriculum will be definitely in par with that. Student skill enhancement. So once we design our curriculum, we will also can set a certain skills which our student should know. For example, Indian medical graduate should know how to record properly the blood pressure. So we can also plan various such skill enhancement once we adopt outcome based education. Outcome focused techniques. So once we know that what our students should learn, we can also start modifying our teaching learning techniques which is focused on the outcomes. And this definitely enhances the global opportunities for our students. Once they have all the necessary knowledge, necessary skills, attitude and behavior, the employability of that particular student will definitely increase and the opportunities will increase for our student. So let us start understanding what exactly this program or what exactly the course is. See, the program is, for example, MBBS is called as a program, whereas the subject we are going to teach is now called as course. For example, phase 1 MBBS, if anatomy, physiology and biochemistry are taught, they are called now as course. Now what exactly program outcomes is? Program outcomes are defined as the objectives which should be achieved at the end of that particular specialization, that is at the end of MBBS, what the student should know. That will be our program outcomes, which has to be achieved during their graduation, means during this phase 1, 2, 3 MBBS, what they should learn, which should be achieved at the end of the MBBS will be our program outcomes. Whereas program specific outcomes is mainly regarding that particular program is. For example, we have MBBS separate, we have dentistry separate, physiotherapy separate. So program specific outcomes will be very specific pertaining to that program. For example, the program specific outcome for a physiotherapy graduate will be definitely different from an IMG, that is Indian Medical Graduate. So that is how the program and program specific outcomes are different. In program specific outcomes, we will be defining what is the knowledge, what is the particular skill which should be learnt in that course which is specific to that particular program. And this is very much necessary for the employability of that student, which is also required for the betterment of society and its sustainability. Whereas course outcome, as I already mentioned, is every subject, for example anatomy or physiology or biochemistry. So those are course, and course outcomes will be what the student should learn from at the end of that either physiology or anatomy or biochemistry. Now for MBBS it is 1 year, which is usually will be measured by the marks which they are going to score in either theory or practical exams. Let us now start understanding what exactly this CO and PO attainment is. Now we have to start calculating CO and PO attainment level. So let us understand how to do that. There are two broad ways to do that, either a direct assessment or an indirect assessment. Usually for direct assessment, we utilize the marks scored by the student either in continuous formative assessment or internal assessment, or summative assessment, that is final university exam or end semester exams. Indirect assessment usually done by using various exit feedback survey form, which will be from the various stakeholders like either students or faculties. First, I will finish the indirect assessment. Here we are showing you few samples of how we can collect the feedback from either, as I mentioned, various stakeholders like students. This is from the students. So we can collect this kind of feedback. So where we can use the questionnaires, various questionnaires, and in terms of either low, moderate or high level. So similar such kind of, this is one example, similar such kind of questionnaires can be used. For example, like what was the quality of course content, was the lectures was properly organized, and did they made you understand better, or did the practical sessions made you understand better. All this kind of questions can be used. Similarly, indirect assessment, we can collect the feedback from the faculties. So as I already mentioned, similar kind of questionnaires can be used. So for example, here we are using like, are you satisfied with the caliber of the graduates and whatever the course we are teaching you. So those outcomes were relevant to our organization's vision and mission. Similarly, such kind of various questionnaires can be used from the faculties also. That is, these two are indirect way of assessment. Now coming to the direct way of assessment, how to do PO, PSO direct assessment. So as I already mentioned, usually in direct assessment what we take is marks that is scored by the student either in both IA marks as well as in university exams. I will be going to show you here one example which is already being done for the biochemistry. This is an example which we are going to show you. So first let me start with each step. First is designing our program outcomes. So as I already mentioned, MBBS is a program, similarly BDS is a program, physiotherapy is a program, nursing is a program, LIPS is a program. Now probably this program outcomes is being done by every institute. So program outcomes, as I already mentioned, should be achieved at the end of the program. So now here the example I am taking for MBBS, and in the MBBS we have 10 such program outcomes. I will not go into the details of any program outcomes, but we need to know what are these program outcomes are which should be achieved at the end of MBBS program. This is already being designed by every institute now. So once the program is done, program usually code will be given which we need to use in the exams. Then the next is program specific outcomes. We have to design the program specific outcomes, that is PSOs. This is also done by every institute now. So for the MBBS example which we are giving here, for MBBS we have 5 program specific outcomes. Now this step is very important, that is course outcomes. So this course outcomes usually will be designed by the subject expert. For example, here we have given you biochemistry, and this course outcomes is designed by the biochemistry subject experts. So they have around 10 course outcomes. So these course outcomes are designed by the subject experts. Once the course outcomes are designed, the next step is mapping the PO with the CO, that is course outcome. Whatever we have designed, we have to correlate that with a specific PO, that is program outcomes. One just example I will give you here. For example, the concept of immune response have mapped with PO1, PO2, PO7 and PO9. For example, PO1 is a clinician, for example. So they should be, for a clinician, understanding this immune responses highly important. This is how we map CO with PO. Probably this is also done by most of the departments now. So this is very important, that is course articulation matrix, how to derive course articulation matrix. This is also will be done by the subject experts. So here comes some values here. So you can see various values like 0, 1, 2 and 3. 0 means no correlation. That means that for that particular CO, course outcome, has no correlation with that particular program outcome. Okay, but try to see that 0 should be avoided as much as possible. Okay, so then next is 1, that is mild correlation, 2 is moderate correlation and 3 is strong correlation. I'll just try to give an example here. CO1 have a strong correlation with PO1 and PO2. So that is being decided by the subject expert. But what you are going to see here is the PO10, the value here is 0. So it's very important to avoid this, that is it's better not to get 0 anywhere. To tell that only we have just taken this example. Please avoid giving 0 everywhere. At least give some correlation value for each PO and PSO with the corresponding COs. Once PO are mapped with the CO, articulation matrix is done, we can see in the table below average CO. That is, we have to add all the, for example, there are 10 rows here, add all the 10 values divided by 10. Whatever we are going to get here, that will be the average CO. For example, here 3 plus 3 plus 3 plus 3. So there are so many 3's plus last 2's. Upon 10, we are going to get 2.8. That is how we get average CO for all 10 POs and all 5 PSOs. Please avoid getting 0. Try to get some value there and try to get maximum correlation. This should be done by the subject expert. Now let us start understanding furthermore steps of direct assessment. So once as a subject expert we design course articulation matrix. Now how to implement that? How to get the attainment value? So here again we have taken the example of biochemistry of one batch of student where they have got the marks scored by the student in internal assessment 1, 2, 3 because we conduct 3 internal assessment, and there is also a score in the 4th column. We can see the university exam marks that has been scored. Now in the phase 1 MBBS we have 150 students who have appeared for all the internal assessment as well as university exam. Now let us try to understand the values. In the internal assessment, what we have to do next? Fix our target value. For example, here the target value what we have taken is 50%. For example, 100 marks, the target value will be 50. That is 50% is the target. This is very important. That is deciding the target score. Here the target score decided is 50%. Now what we have to understand is, in the IA1, out of 150 students, 111 students have scored more than the target score, that is 50%. That means 74% of students have attained more than target score. That means we are here, if you see in the red, if you get 3, means if that's more than 70% of students have attained that, you should value it as 3. If more than 60%, 2. More than 50% of students, 1. Here how much we got is 74. So A will be 3. Let us try to understand similarly IA2. So in the IA2, 73% students have got more than target score. That means more than 70 means it is again B is value how much we got? 3. Now IA3, again 72% is the number of students who got more than attainment. That means again the value C should be 3. Now in the fourth column we should take the IA average. 3 plus 3 plus 3 upon 3 will be 3. That will be our D. Next, sorry if D is not visible, but it will be D. Now in the next column, the final university exam. Here out of 150 students, 102 students scored more than target score, that is 68%. So 68% means now the value will be 2. Okay, so that will be our E. So we got A, B, C, D and E. Now this is what is very important, getting the F value, that is average CO mapping, which is depends on our D and E value. 50% of D value, that means we are giving lot of importance to IA, and 50% will be considered from the university final exams. Now there how much we got D? 3. So 50% of D is 1.5 plus 50% of E. So E was here 2. So 50% of 2 is 1. 1.5 plus 1 was 2.5 will be our average CO mapping value, that is F. Now this is very important. Now how to get this final marks, that is attainment value, PO, PSO attainment value. For this we have to use the CO average into average mapping upon the maximum attainment, that is 3. There the maximum attainment we used value was 3. So there average CO how much we got? In the last example we used 2.5 into. So here I am giving you one example of first PO. The average mapping when a subject expert was done, they got 2.8. That is the average mapping value, that is M value upon maximum attainment, that was 3. So for PO1, the PO or PSO attainment level that was scored was 2.3. Similarly, we should get this value for all the 10 POs and for all the remaining PSOs. So once we get the value everywhere, we are going to derive a graph like this. That is PO and PSO attainment level. So if you look at the graph, so we can see that whatever as a subject expert we are expecting, that much of attainment is achieved by the students. So as I already mentioned, try to avoid 0. So if you look at here in the graph PO10, there is nothing. It's better to avoid such type of graphs. Now once we understood that both direct and indirect assessment, now let us see how the final attainment of PO or PSO is achieved. In that 80 to 90% of direct assessment will be considered and 10 to 20% of indirect assessment. As I already mentioned, indirect assessment includes the feedback which we are going to collect from various stakeholders, that is students and faculty, whereas direct assessment by using marks, that is coding internal assessment as well as in the university exams. So lot of importance is given to both internal assessment as well as for the university exams. So what is very important now here is software will be developed which will be helping all of us in calculating all this P1, PSO attainment value. But as a subject experts, what we need to do now in the software development is, while we are preparing our questions, we have to give CO1 value along with the Bloom's taxonomy for each different type and different level of questions. And I would like to mention special thanks to Dr. Clementia Chelli sir, our Deputy Registrar sir, SDM University, for providing the learning materials for this, and also I would like to extend my thanks to Dr. Vidya Patil madam, who is really taking a lead in preparing all this question bank for our SDM University. So any queries we are here to address. Thank you.